Hello everyone. Welcome to Geriatrics of Traditional Chinese Medicine online classroom. Nowadays, geriatrics of traditional Chinese medicine plays a more and more important role with the aging population. So, what are the geriatrics of traditional Chinese medicine? This is the first thing we have to think out when studying geriatrics of traditional Chinese medicine. Specifically, geriatrics of TCM is a clinical discipline that elucidates the etiology and the pathogenesis, the law of treatments, prevention, and care of sinus diseases based on TCM theory. In this regard, four questions need to be clarified, namely the elderly population, disease spectrum, physiological and pathological characteristics, and clinical characteristics, which are also the main contents of our study today. Firstly, geriatrics is aimed at the elderly people. The age of 60 years or older is considered as the elderly in China. Specifically, 45 to 59 years old is considered as the pre-old age, also known as the early old age. 60 to 89 years old is the elderly age. Over 90 years old is regarded as long life. The United Nations World Health Organization proposes that the standard for judge an agile society is 65 years old. Actually, aging is a gradual process. Different people begin aging at a different age. The time when different organs starts deteriorating is different. The decline of structure and function of an organ may start ahead of or after other organs. Secondly, let's talk about the definition of the disease spectrum. Geriatric diseases were special characteristics generally referred to diseases that people suffer from in older age and are related to aging. Geriatric diseases include various diseases and can be roughly divided into the three categories. First, age-related incapacitation disease generally occurs in old age, such as Alzheimer's disease, senile cataract, elderly emphysema, and enlarged prostate. Actually. Second, diseases related to the decline of the body's resistance to disease mostly occur in old age, although these diseases also occur in the middle and young age. They are obviously related to the aging of the body, and the incidence rate gradually increases with age, such as coronary atherosclerotic heart diseases, chronic bronchitis, hyperlipidemia, and malignant tumors. Third, the prevalence rate in the old age is basically the same as that in the young and middle age, but it has some differences. The senile diseases may also be related to the relevant diseases occurred in early years, such as peptic ulcer, chronic gastritis, chronic nephritis, diabetes, rheumatoid arthritis, and children. Thirdly, the physiological and the pathological features of the elderly. There are differences and connections between the physiological and the pathological features of the elderly, and it's even a bit difficult to separate completely. In this lesson, the physiological features will be discussed first. The hypofunction of vessels in physiology is the root cause of the body's aging changes, and it is also the main feature of physiology in elderly people, which is reflected in the changes of the vessels, yin and yang, qi and blood, spirit, physical, apparatus, movement, and daily life. Physiological features are low from the changes of vessels, yin and yang. Exogenous, pathogenic factors, 7 emotions, diet, urine, and feces. First, the asunia of vessels. Let's take a look at the understanding of human aging in 10 年 separate to private, which should be the earliest and most comprehensive theory on age. This passage shows that age begins with the liver. After 50 years of age, liver qi begins to decline, affecting the diuretic gene and the release functions of the liver, contributing to no desire to talk. Being suspicious or irritable, eructation, abdominal distension, or visceral matter. After 30 years old, the heart qi becomes deficient, and the heart blood is insufficient, leading to palpitations, shortness of breath, and weakness pervading whole body. By the age of 70, with a more deficient spleen qi, the older people are characterized by scleropenia and dry skin. After 80 years old, lung qi is more deficient, so weak breathing, chest tightness, shortness of breath, and talking insano occur. After the age of 90, kidney qi and kidney essence are deficient, so that they cannot transform and produce yin and yang to support vessels. Therefore, the dysfunction of the 5 zang is the root cause of human age. With the deficiency of yin and yang, qi and blood, the ability to resist pathogenic factors decline. It is easy to get sick and it is hard to recover. Namely, as a candle in strong wind and a fragile vein is vulnerable to all kinds of illness. Second, gradual deficiency of yin and yang. Easy to understand as the fire of kidney declines, the body's yin and yang, qi and blood become deficient. Compared with the children's zhen yin and zhen yang, the elderly can be called deficient yin and deficient yang, which plays a vital role in the occurrences, development, and the outcome of gyratic diseases. Yang qi is especially critical in this process, and we need to pay more attention to it. Susceptibility to exogenous pathogenic factors. With the asthenia of viscery, deficient qi, hyperfunction of wei qi, internal patients are susceptible to exogenous pathogenic factors. There are several characteristics of the elderly people. 1. Susceptible to yin pathogenic factors. The qi in elderly people are deficient, especially yang qi. Therefore, cold and diabetes are the main exogenous pathogenic factors, resulting in common cold, stomach ache, vomiting, diarrhea, and B syndrome due to yin imbalance. The elderly people are more susceptible to pathogenic factors than the young people. Elderly people are physically weak, intolerant to temperature changes, and even normal climate changes can be their pathogenic factors. Therefore, the incidence of seasonal colds, summer heat stroke, autumnal and winter cough, and other diseases in the elderly is significantly higher than that of young people every time these changes occur. The invasion of exogenous pathogenic factors to the viscery deplete. The elderly with the asthenia of viscery, deficient qi and blood, are vulnerable to exogenous pathogenic factors. The older they are, the more serious diseases will be. For example, when the frail elderly people suffer from chills, fever, headaches, and body pains, the manifestations of hyperfunction of heart and kidney like vomiting, diarrhea, sweating, deep pulse, or seriously weak pulse occur. 4. Being vulnerable to abdominal changes of emotions. Since the deficient heart qi, deficient liver gallbladder qi, poor reducing functions of the liver, and poor determination ability, the elderly people are the more vulnerable to abnormal changes of emotions. The clinical manifestations are forgetfulness, language errors, sleep disorders, visual and hearing difficulty, depression, and moody state, etc. 5. Being vulnerable to stagnation. Elderly patients are vulnerable to station, which shows on two aspects. On the other hand, older people with dysfunction of the spleen and the stomach are vulnerable to food stagnation and feel uncomfortable. On the other hand, since qi deficiency, yang deficiency, and the deficiency of qi, blood, and fluid, the gastrointestinal tract loses its moisture and the intestines are obstructed. Then constipation occurs. Clinically, diseases caused by hyperfunction of spleen, like testis and agratio, chest pain, nausea and vomiting, eructation with a fetid odor, abdominal pain and diarrhea and constipation are common.